Kathy Montgomery and her dog Mick have an important job to do today. Kathy is in charge of Sutter Hospital's pet therapy program.
Sutter's Paws on Call is a group of volunteers. We have about 20 to 25 volunteer dogs. And our job is to come around and visit with the patients. Okay, in we go. Hello.
Oh, hi.
We're not walking in when we come in with these dogs and asking them how they're feeling. We're not coming in with needles. We're not wearing a white coat. We're just there.
Hi there. It takes my mind off my back and the other pains that are going on. Bringing happiness to everybody you visit, aren't you? For some reason, it just kind of goes away for a brief moment.
We know that what we're delivering is important. It's the stress relief. It's just breaking up that moment.
Yes.
Hi there. Hi. This is Mickey.
Hi, Mickey.
We get the same comments from nurses that we get from patients, and the nurse will say, I so needed this today. They may have lost a patient, and then here come the dogs. So it's just as much, absolutely just as much for the staff.
Not only do I feel like they're making a difference, they are making a difference. It provides patients with a sense of what is normal, and that makes all the difference in the world to a person.
So good to see you.
So much of how we engage with patients is foreign and unfamiliar and frightening, and I think patients appreciate a moment when they can see a friendly face at the end of the leash.
It's very heartwarming, and it just makes you happier.
I've been humbled by seeing some of these very simple moments be super ultra meaningful.
I don't have words to explain. Yeah.
Being a good boy.
It means a lot to me.
At the end of the day, we recognize there's this super important relationship that can help healing. It's incredibly powerful.
So are the dogs indeed a powerful form of medicine? Researchers at UC Davis are trying to answer that very question. They're part of a nationwide study seeking concrete evidence that a dog's presence does have a positive and observable impact on a patient's physical and emotional well-being.
Angus, this is Fabian. Say hi.
Pediatric oncologist Dr. Anjali Pawar is one of the lead physicians for the study at UC Davis.
Statistics depend on cold numbers, but we have seen with our own eyes the difference these canines made.
Feeling better now.
It helps with the stress. Absolutely, it helps with the stress.
A group of children who were recently diagnosed with cancer were at the center of the study. Dr. Pawar and her team measured the effectiveness of the therapy dogs by testing the young patients' stress levels.
What we did was get their baseline monitors like heart rate, blood pressure before the visit and after the visit. Then, depending on the age of the child, if the child was 12 years and older, they answered a questionnaire.
Not only were the children tested, but so were the dogs provided by volunteers at Lend a Heart, another volunteer pet therapy program. They collected saliva samples from the dogs, and the samples were then tested for the stress hormone, cortisol. Final data is still being collected, but if the results end up showing a clear benefit to both dogs and children, the hope is that it will pave the way for a wider use of therapy dogs in hospitals.
I wish it convinces our institution to have dogs in a cancer center on a regular basis instead of just once in a while.
Ultimately, Dr. Pawar believes exploring the human-animal bond is a crucial path in helping patients heal.
I think this trial, Canines in Childhood Cancer, is a small step towards providing something besides the pharmaceuticals. We have to look beyond just medicines. We have to look at the patient as a whole. So making any part of their life less stressful, I think we should definitely focus on it. And that means getting the dogs to help us out. We should go for it.